Hi everyone, welcome. I'm Sonik Sikka, Senior Lean Operations Manager at Sheppard Pratt. I oversee our operational excellence team, which focuses on process improvement, revenue enhancement, and care coordination efforts across our enterprise. Today, I'm here to really walk you through how we have streamlined and optimized our admission process at the largest nonprofit behavioral health provider. Um, I'll start with the why and our challenge. As many of you may know, that wait times in ED are a growing issue. Here in Maryland, we see an approximately 1.5 hours longer than the national median. So at Shepherd, we have 400 licensed behavioral health beds across two of campuses. What we saw was an opportunity to really help reduce those delays and help streamline how patients get admitted into a behavioral health place. So, what was our approach? We actually started with a value stream mapping event. It's a lean methodology that helps you to map out the full process from start to end. So, we brought together a cross functional team representing admissions, clinicians, leadership, which help us to identify the bottlenecks. So from that event, what we learned that we have gaps in our communication, we have lack of technology integration with multiple systems in place. We also saw some unclarity around roles and responsibility across some functions, which again, overall, were some of the leading causes of delay in our admission process. So, from this event, we also brainstorm dozens of ideas, and from those dozens of ideas, we collectively, as a group, prioritize the top 13 improvement ideas that we felt will make a bigger impact based on the level of effort and the feasibility of those initiatives. So I'll spend a minute here to just go through some of those improvements that we made, and I'll touch on some of the key ones only, just due to the time constraint. We What we did was we actually integrated our patient tracking system with our EMR system, which now help us to have a real-time view of where the patient stands through their patient journey, and it also helped us to open the access to beyond the admissions team, which was a huge thing for us. We also created a centralized screening role, which also helped to oversee all the admission decision, which further helped to reduce delays. We standardize our discharge notification, which actually help streamline some of the discharge notification downstream. And finally, I'll say that we have also created some stoplight approach, which help us to improve the communication between the admissions team and the nursing units, so helping with bidirectional communication. Uh, all in all these four were some of the major impact that brought to the initiative. Along with these, we also strengthened some of our communication system. For example, we implemented a daily management system with representation across cross-functional teams and making sure everybody's aligned on the same priorities. We also introduced some real-time dashboards, which further helped teams to have better bed management and better discharge planning and predictability analysis capabilities as well. And finally, we also introduced ambulate service, which was quite an innovation in itself, because we were hearing often that from the EDs that we have patients that are ready to be discharged, but we are still waiting for reliable transportation. So we introduced this ambulate service, which was actually deployed to really move these patients from EDs to those inpatient beds, which eventually help improving the access to care and reducing some of those delays. So managing all these changes was always not fun, especially when you're throwing so many changes at a single group. So we try to manage things pretty closely. We actually introduced a new role within the admissions team, which was mainly basically doing a air traffic controller role in managing the patient flow and bed assignments. We also invested heavily on staff training by providing a lot of training sessions along with drafting a lot of standard operating procedures for the team. Some of the results that we measured were, we measured the discharge notification process to the bedboard, which were coming in line with our initial goal of 30 minutes. We also saw an improvement in our compliance for discharge by noon for both the campuses. And finally, we saw an improvement with transfers from ED to our inpatient beds, which were resulted in higher occupancy rate for both campuses. So overall, I think I'll just leave with the four success factors that I learned from this initiative were having a technology integration, better role clarity across the teams, having structured communication and cross collaboration representation. I think overall helped us to really achieve the results that we have achieved today. I hope this was informational and helpful session for you. So thanks for tuning in. Bye.